Compassion demands this be done. It's a medical centre for people who need it most, the vulnerable, the forgotten. It's all set, has been ready to go since January, but there's a problem. It can't find any doctors.
Bill, all the stuff, no staff.
All the stuff and no stuff. This room here, we've set this up for mothers and children.
Empty corridors lead to doctors' surgeries without doctors.
It's a waste of time giving a lot of the people we see an envelope with a referral. It's got to all be done now.
So a one-stop shop.
A one-stop shop.
Nurses' stations, missing nurses.
And just down here, just around here, we're just setting this up now, as you can see. This is free dental for people. Like we get people coming, people who share false teeth, you know, people who pull their teeth out with pliers. Well, here we've got a free centre so people can be looked after properly.
That is, if Reverend Bill Cruz can find a dentist to employ.
People can come here, they can find they got a free doctor, they will have free dentists, there's drug and alcohol, domestic violence, all the sorts of supports that people need, mental health.
It's a vital service, but it's only operating 1 day a week because nobody wants to work here.
That's a sin. In the west of Sydney, to be only open on Mondays is a sin.
Bill Cruz opened the free healthcare clinic in Blacktown 3 months ago. He hasn't had a single offer from an Australian GP since he began advertising for the job in January, despite paying up to $170 per hour.
Like, we're not doing this on the cheap, we're doing it properly so that people get proper treatment, you know? Like everybody deserves that.
I think I'm probably fully booked for the next 2 or 3 weeks.
GP Dr Nada Andrick works at Bill's original Ashfield clinic, also in Sydney's West, where the waiting room is packed to the rafters 5 days a week.
We would probably see 15 to 20 patients a day, and we see them sort of quite, I guess, in depth. So we have long consultations, 30, 40 minutes, and try and meet the needs of the person that we're seeing, or as many of the needs that they have at the one time.
The government pays GPs $43.90 per standard consultation, which lasts between 6 and 20 minutes. The average out-of-pocket cost for patients is around $100. At the Bill Cruz Foundation, society's most vulnerable can receive essential support along with a meal for free. But it's not easy work.
You know, you really have to try and find everything cost-free. And that can be quite clunky in a system that really doesn't understand our patients. You know, we don't have patients that are great at forms, we don't have patients that are great at keeping track of their money, and we also have patients that are already quite reluctant to see sort of mainstream health services.
So GPs aren't attracted to those areas where the income is less, the support is less.
GP Dr Tim Senior from the Royal Australian College of General Practitioners says there's been a focus on getting doctors into rural and remote areas and less in underserved areas in our major cities.
We need to pay attention to providing care to people who experience disadvantage because health systems don't run on altruism and they need to be specifically funded the whole range of care that people actually need.
Bill's confident this waiting room will soon be full.
Well, hopefully we'll get some calls from doctors in the next few days.
And he's not giving up.
What happens if you can't find anybody to work here?
Don't ask me those questions. We're going to do it. We're going to do it. Loving compassion demands this be done. There are people out there at this moment within walking distance of this place who need us. So we will be here until we get the right people.
Well, we love Bill and we know him. You can bet he'll be throwing everything at this. So if you can help in any way, please reach out. We need that clinic up and running, and soon.